I want to welcome everybody on behalf of the United Way Association, Together SC, and the South Carolina Grantmakers Network to the 734,862nd Zoom call that we have held to keep our philanthropic and service community connected in this time of COVID. I was on a call yesterday, and if my memory serves, the governor closed the schools down March the 16th. Of 2020. And so to think that we're now coming in on 12 months of this being the new norm or our reality is really amazing to me. We've got an important program today. The South Carolina Sisters of Charity Foundation of South Carolina commissioned a report that looks at the structural factors associated with poverty. And so we're thrilled this morning to have Chynna Phillips, who is the Director of Research and Policy at Sisters of Charity. And then Naomi Lett, the President and CEO of United Way Association, who's going to be talking with us about how the information Chynna reviews with us can be used to inform philanthropic work. So again, grateful that all of you are here, grateful that you're making time out of your day to learn more about this important information. Madeline reminds me that we've got a new friend in the audience. Scott Weirman is the new CEO of Community Foundation of the Low Country. He came to us from Winston-Salem. Scott, welcome to South Carolina. We're glad that you're part of the family now. And so with that, I'm going to turn things over to Chynna. He's going to tell us a little bit more about the report. And I should have said in the beginning, when Sisters of Charity made the decision to commission the report, they were very clear that the central goal was to identify, acknowledge, and examine the systemic and policy factors that lead to, reinforce, and exacerbate poverty, specifically for residents of South Carolina. So with that as background, take it away, Chynna.
Thank you so much, Chris. And of course, to Together SC and United Way Association and the Grantmakers for allowing me to come and share with my colleagues and others at arms. So I'm gonna kind of start off a little bit different and just kind of center us, if that's okay with everyone. So I just want to welcome you into this space, however you identify, whatever mood you are feeling. I'm grateful that you chose to spend this time with me and my colleagues. I welcome you into this virtual space that we created, wherever you are on the spectrum of diversity, equity, and inclusion, and wherever you may enter on the socioeconomic status. I understand that I'm asking you to think of another's condition during a time of a global pandemic. And at a time when you may be experiencing some hardships, but I'm hoping that in our shared humanity, that we can gather together and just think about others. So hi, everyone. As he stated, I'm Chynna. And I have this quote here because it centers us, because what we know is that while the data is new to us, and it's informing us of what South Carolina currently looks like, the conversations are not new at all, by any means. One of the many reasons I'm excited about this study is because it begins with the understanding that poverty in general is complex and multifactorial phenomenon. And those who lived with lived experiences and who are advocates alike understand that experiencing poverty is cyclical. I want to thank Melinda Merrill, Dr. Melinda Merrill, who is dynamic and kind of led this study for us, and all of the graduate students who assisted as well. So we're just going to go forward. So here we have, so our study is available, and in the top left part of your screen here, that's just a screenshot of the executive report that's available for anyone. I think it's a quick document that you can easily print off and share with any legislative leaders. Naomi will then share a little bit more of how you can use this information, but I'm going to highlight really two kind of pieces to share the duality of how we can focus on caring for the person, immediate needs, while also addressing systemic needs as well. And an example of how we do this every day at the Sisters of Charity Foundation is you can look no further than how we fund. So education, economic, and health outcomes are what we're going to focus on. But know that within the study, the public health model was used of the social determinants of health, which provided a foundation on which to further the study. And it split the findings into 6 structural factors: economic stability, neighborhood and physical environment, education, food security, community and social context, and healthcare. These were evaluated, and then we identified the systemic and policy elements related to each. So we'll just move forward here. So this first one, and for many of you who joined our first webinar, this is a slide that you'll remember, and then we'll jump in a little bit further. But the overall trend in the percent of South Carolina's population experiencing poverty shows a decrease, actually, with the initial data recorded in the 1960s of the US Census, right? So right now, 16% of South Carolina identifies as experiencing poverty. And then when we go a little bit further, we see that Black or African American people in South Carolina were 43% of the population, yet only 27% of the state's population. So when I move further here, this slides provide additional context for a few of you, because I know that this was requested. So one of the reasons why, but we have to remember that correlation does not equal causality, right? So I just want to state that up front when I present all this data. So community and social context play a role in determining resources that are available at a local level for preventing and addressing poverty as a social integration, cohesion, and the collective. But when we move forward here, we start to see that considering race and ethnicity minority populations in the state, these groups disproportionately had higher rates of poverty compared with their white counterparts. Lastly, people without a high school diploma also disproportionately experience poverty. We will continue with education soon and kind of jump into that data, but populations experiencing poverty in South Carolina aligned with the literature around people who are most likely to enter poverty and least likely to exit poverty. So I know those rates are stark here, and I do believe that we will be giving slides to everyone afterwards. So you'll have access to this information as well. And then also, if you want access to some of the data, we can provide that as well. So I'll move forward here. So I mentioned social cohesion before, but poverty itself may be another factor that limits social cohesion. Financial disparities create barriers to generating collective action through separation of people based on their access to resources and or their socioeconomic class. Persistent poverty is defined at the county level by the USDA's Economic Research Service as those counties where greater than 20% of the population has been identified as experiencing poverty in the US since 1980. And so pause there for a second and understand that these counties have experienced poverty for 40 years, all right, has been identified as persistent poverty. So for some families, this means poverty spans 3 generations. And the US has had an estimated 353 of these counties as of 2015. 20% of them were in the South and 12 of them were in South Carolina. You'll see over on the other side of that screen, we have highlighted there persistent child poverty, which has been identified similarly. And of the 708 identified as child poverty counties, 24 of them were in South Carolina. So within the state, 26% of all counties were identified as persistent poverty counties, while 52 were identified as persistent child poverty counties. And so there are some amazing organizations that are kind of leading the way on this. So we're just going to move forward here, and I will mention those organizations. in a few. So here we have the per pupil investment in public education. I'll spend a little bit more time here because we have multiple studies have found the strong association between a family's socioeconomic status and a child's academic achievement. So children who come from families with low socioeconomic statuses develop academic skills slower than their peers and families with a higher status. And this is in correlations with ACEs. Some of you have been a part of that conversation, and we'll just move forward. So this slide here is showing that lower overall investment in public education were found in counties with higher proportion of Black residents. In the history there, I would say if we kind of look back, in 1993, education leaders in more than half of the state's school districts, largely from rural and low income areas, and many of which had large numbers of racial ethnic minority students, sued the state for inadequate and inequitable education funding. So some of you may remember that. And while little action was taken during the 27-year period, what we did see is that the result of the disinvestment of the public education in South Carolina is that, for one, counties with higher proportion of Black residents have had an average lower overall investment in public education. So this lack of investment in public dollars intensified by white flight, for those of you history buffs in the room, or so-called segregation academies began in the 1970s. So I think it's important for us to kind of parallel what history has done, and then kind of look at how we're still feeling those results now. So once again, this data is not new, but this data is new, but the conversation is still the same. So what can we do to make sure that this doesn't happen? Go for it. So here on this slide, we have a little bit more, and I really want to highlight education because we didn't get into it much in our last one. So in South Carolina, approximately, or compared to other states, teachers in South Carolina earn 25% less on average than those similar educational attainment. And I'm getting a few notifications here. We'll answer questions at the end. In fact, teachers in South Carolina earned less in 2017 than they did in 2000 after we adjusted for inflation. And so over 7,000 South Carolina teachers left their position. Over a quarter of those left to teaching in other districts. They went to charter schools, they went to special school types. And so not only do high turnover disproportionately affect districts in low income areas, but often high numbers of racial minority students, but they also represent a high cost to districts when trying to recruit more teachers. So additionally, we have here multiple studies suggest that schools with lower student-teacher ratios may have better outcomes. And so among South Carolina counties, Dillon County had the highest of 17-1, with Fairfield County coming in with 10-1. And so we've seen a lot of good things from Mr. J.R. Green in Fairfield County school system, doing great work, and even upping the amount of which teachers are getting paid in Fairfield County as well. So that's a good case study for any of you who are trying to think about examples to bring to others. The next is that there are some reported statistics to measure academic success and career readiness in which students complete their coursework. So in a school year of 2018, 19% of the South Carolina students did not graduate from high school, thus failing to obtain the minimum education qualifications. And then this last point is something that I think Donna is on the call, for Donna, Melinda, and I, and the graduate students, maybe the graduate students were hip to it, but in 2019, the report said that in an affordability of all 50 states, flagship schools, that USC came out as the second most unaffordable school for low-income students. The second most in the nation, right? And so what does this mean when we're trying to advocate for individuals with DACA? I know there was a lot of work to try to make sure that they can get into it for my Greenville partners who are on the call, but that's just something to think about as well. So I put this slide on here for the corridor of shame because I think almost everyone has talked about the corridor of shame and brought this up. And it's been something that has gone on for years. But these counties highlighted here are some of the same counties that we see with the persistent child poverty rates and the persistent poverty in general. So it's kind of not a surprise there for many of you, I'm sure, as I'm looking at faces and their reactions to it. So I just put this here once again to share those statistics. So now moving on to building wealth when it pertains to gender. So the annual median income in South Carolina was a little over $51,000 compared to the average of about $60,000 in the US. And there was a wide range of incomes from counties across the state, from as low as a little over 24,000 in Allendale, to Beaufort, which jumps up to 63,000. These inequities in earnings between men and women were also present within South Carolina women's earning at 72% of South Carolina's men's earning. And so, of course, on the slide here, I have pulled out some when we start talking about the ownership of business. So income inequality is an indicator of the ability of certain groups to accumulate assets and wealth. Outside of home ownership, which has been discussed in our previous webinar, the dynamics of business ownership in South Carolina may also influence the inequities. So simply put, those who played a part in creating wealth were less often a racial ethnic minority and or a female person, okay? Over time, disparities in wages, earnings, and asset accumulation led to inequities in wealth. Levels of home ownership touted as a primary driver for wealth accumulation for low-income families are different among racial and ethnic minority groups. And so this last piece here related to women and especially racial ethnic minorities, they experience persistent wealth gaps due to the historic economic oppression associated with laws that previously denied their ability to acquire and obtain an education. In South Carolina, women own 21 cents to the dollar for every man. And then when you start talking about women of color, that jumps down to 5 cents. So we can only imagine the outside effects of that. And I thank REN for a few studies that they've done. They're an amazing organization that you can kind of reach out to for additional information. So now when we talk about the unbanked versus underbanked, and I have the definitions here on the slide for you. So the lack of regular access to mainstream financial institutions may also limit self-sufficiency due to high costs of using alternative financial services, such as payday loans, non-bank check cashing, and money order services, rent to own. I think when we're talking with the community, most often they will tell us there's a blueprint of how their area looks, right? There aren't many grocery stores, but there's tons of places that takes stuff out of their check. So households are considered underbanked when they do not have any deposit account with their mainstream financial institution, and underbanked when households have a checking and or saving account that was recently with an alternative financial service. So the proportion of underbanked households in South Carolina as of 2018 was 8.5% compared to the average of 7.1%. So 22.9% of South Carolina households were deemed as underbanked. And you can see that difference as it pertains to race here on the screen. And I think in one of the examples that we're going to provide later, it's really making sure that individuals know how interconnected all of these subjects are. So debt can also block a family's pathways to financial or self-sufficiency. So the financial burden of paying off debt may be difficult. And 27% of South Carolinians had medical debt compared to the 16% nationally. And so if you want more information, of course, it's available in our larger study. So as we begin talking about health access, we have to then talk about transportation, because once again, all of these things are connected. So delays in seeking treatment can worsen existing health conditions, ultimately causing high future health costs and potentially even disability or death. In addition to limited access to healthcare due to cost concerns, there are many areas in South Carolina where physically it is difficult to obtain needed services. Closures to healthcare provider sites, most notably rural hospitals and OB services over the past decade, create barriers for families seeking convenient, cost-effective healthcare. Unfortunately for rural hospitals in South Carolina, they have closed in the last 8 years in Bamberg, Barnwell, Fairfield, and Marlborough counties. For all of you on the call, I'm seeing head nods because you know this is our reality. We know this to be true. In 2010, there has been 133 rural hospital closures around the country, most of them being in the South. In the neighboring state of Georgia, 6 closures have occurred during this time. 4 have occurred in North Carolina. And so now we just need to start beginning to have the conversation of what does this mean in the age of COVID, because this was hard before, right? And so as more people are being taken to the hospital, put in, and we're depending on our healthcare systems. So you may think it's not an issue for the larger inequity, but for South Carolina, for South Carolinians, adequate physical environments are threatened by residents' inability to access affordable housing and or transportation. So let's go over to the next slide here. So on this slide, it goes a little bit closer into the hospital closures. So while physical accessibility to healthcare services sites is critical, there must also be an adequate number of well-trained healthcare professionals available to staff facilities. Unfortunately, South Carolina has long-standing healthcare shortage, and we see that especially with our nurses. Right here, we have highlighted the 2 best, or the best ratio by county for our primary care physicians, and then the 5 worst. And so I'm seeing some head nods because it makes sense. There's no surprises there. And for others, this may be a stark reality, but we wanted to make sure I have this slide available. So with respect to the development of the new and innovative healthcare worker strategies is actually a very good model for many because it can play a crucial role to the healthcare system with boots on the ground in the community. And for any of you who have a relationship with your CHWs, you know that sometimes they can get you better information than anyone else. So that is a good model as well. So a little bit deeper here. Now we'll start talking about food access. So that last piece of the personal. So according to the US Department of Agriculture, food insecurity is an economic condition defined by the lack of access to enough food to sustain and support a household nutritional needs. So the cost of food in the US increases annually as a result of commodity pricing, packing, and all of that information. But what tends to happen is that we don't take that into account when it's time for foreclosures. So as of 2018, the state food insecurity average was 11.8%, which was similar to the US average, which was 11.5. So this isn't that huge, stark difference that we're used to when talking about South Carolina. But in York County, they had the lowest food insecurity rate with 8.3%. And Allendale had the highest at 17.7%. So again, the national average is about 11.5, and then Allendale coming in at 17.7. And so since I have so many funders on the call, I want to thank everyone for what you did with the shared banding together and making sure that we had communities when it came to COVID with supporting them. But these are realities that was even before COVID. And so I wonder what's going to happen next. So Naomi, I'm finishing up soon. So on this slide here, one of the biggest things is, as we think about moving on to the future of how we want to utilize this information, one, of course, to our grantee partners, we want you to put these numbers and figures and develop new programs or use this to support and rationalize the programs that you have. And then that next piece is the targeted investment, which kind of Naomi will kind of speak to a little bit more. But one of the biggest things for us is how do we measure long-time impact if we don't have some type of baseline? And I'm so proud to say that this baseline is created right here in South Carolina by someone who knows us. So Dr. Merrill. And then when things came up that we wasn't aware of, we reached out to our grantee partners and said, hey, is this making sense? Can you breathe some life into this and make sense of the numbers? And so you'll see that the document that we have is very readable because we knew that from the very start, we wanted that to be. And then for advocacy, putting these numbers to good use looks like making sure that we have a face behind these numbers and that we can speak to all aspects of an individual. And then just this last piece here is fostering social change. So a while ago, some of you might have remembered MDC coming and talking about how are we utilizing our SMR. So outside of our financial capital, how are we making sure that we're using our social capital to kind of move the needle? And so of course, convening like this, but then also forming authentic relationships and then pooling our resources. So great job, you're already doing it. The question is, can we continue doing it and continue doing it in a smart and thoughtful way? And so with that, that is my presentation here, and I will stop sharing. So Naomi, you can pull up.
Chynna, thank you so much for that. Really important information, and you did it so well to summarize it in a 20-minute time frame. I do want to encourage folks that may have questions to include them in the chat or send them via private message to me or to Chynna. I know Dr. Melinda Merrill is on the call, and she has answered at least one question in the chat box. So thank you, Melinda. As I said, we will double your pay for being on the call. And stepping in. We want to pivot now to Naomi Lett with United Way Association of South Carolina and talk a little bit about ways that we on this call can take this very sobering information and turn it into some sort of action. So Naomi, take it away.
Thank you. I remember to unmute myself. So these are just a couple of examples. When we were in early conversation about this, you know, we've done a lot of work around publishing data and wanting to share that with people, but also wanting to talk about what do you do with it? What does it look like? How do you use it practically to inform the work that you do? And so these are just a couple of examples. I know I have a lot of my peeps on the call today. So I just want to say these are a few examples of what the United Way Network does. There are many more activities going on than just what I'm sharing today, but I wanted to highlight what this looks like for us. And we have I think that there are two approaches to working around poverty and the data that we're seeing. One is around helping people in poverty, and one is about helping people out of poverty. So we have multiple of investments across the state that help meet basic needs, because you can't help people out of poverty if they're not helped in poverty. If their basic needs aren't met, there's no way that they can move up Maslow's hierarchy of needs. There's no way that they can advance economically or think about savings if they don't have food to eat. So both approaches are really important and create lasting change. But definitely, as we see it, the efforts need to go together. So I will not be able to see the chat box. So if there's any questions that come up, please somebody let me know. So the basis of our work is the self-sufficiency standard. This was a collaborative effort with the Sisters of Charity, Central Carolina Community Foundation, the Riley Institute, several others, and really creating information that people could use about what is real for families in South Carolina to be able to live without needing public assistance. So the self-sufficiency standard, for those of you who aren't familiar, use all of this information listed here to calculate what do families need to make in order to not rely upon any outside benefits. And this is just a quick snapshot supporting, and we'll see, the report and what Chynna has gone over is reflected here. And what we know is that costs continue to rise. So as some of our communities become more prosperous, it becomes more challenging for the people in the community who are poor. Those who are poor in rich communities are more poor because the surroundings and the cost of living around them increases. So this is an example of how that's broken out. I just wanted to share it quickly with everybody as we walk through this information. And looking at how we build livable communities. What does this look like? The conversation isn't just about wages, it's about what our communities look like. So we have encouraged people and use the self-sufficiency standard to encourage our COGS, our local leadership to really look at key items, both on the state and local level, that are going to make changes. So these are core areas where we focus to be able to create environments that are more supportive for people, no matter where they land on the economic spectrum. So I wanted to share with you just a few examples about program investment and strategies and economic stability from our United Way network. These are highlights, and if you're interested in learning more, please put your inquiry in the chat box, and I will connect you with the folks from these communities, because we're really excited. So this is United Way of York County. So they have taken on a single issue as their goal and what they fundraise over. And that goal is to help 3,000 families achieve financial stability by 2030. As you can imagine, their work has gotten a little bit harder because of this small thing called the global pandemic. So they really have their work cut out for them. But all of their investments are in these core areas. So they did an extensive study with Winthrop University about their community specifically and how they would have to achieve that. And you're going to see some common themes here, right? Because we understand that there are some fundamental challenges that people face that we can draw out from the data that can possibly make changes either through our investments or through public policy. So financial literacy is a key piece, and you're going to see that across, but these are all the ways that they work with families, right? This is about empowering people to understand the environment around them and address some of their highest costs. And what we know from the self-sufficiency standard, when you move over to supportive services, that childcare often costs more than housing. And so if we're looking at people's ability to advance, especially for single mothers, childcare often prohibits them from economic advancement. And we'll see a little bit more specifically in some other examples what that means. And workforce development. You know, the exciting thing about South Carolina is that we've heard for years about all the jobs that are coming in, and that there are 2 jobs for every person. Now that landscape has changed drastically recently, but our economy continues to grow. But that doesn't mean that that opportunity is there for everyone. So one of your county's key components to the work is job training, because if the people who live here don't have the skill sets to take the jobs, they don't qualify. And so people are coming in from other areas to fill those. And again, they get left behind. So making sure that we are, excuse me, creating long-term opportunities that are focused around job training, education, credentialing, and then job placement. These are heavy investments in human advancement. So where we help people in poverty with food boxes, meeting basic needs, those are smaller investments per person. These are more intensive investments in individuals advancing, but it is also generational. And I think from the information that certainly that Chynna shared, we know that when we say poverty is persistent, if 40 years is a long time, that is certainly persistent. So moving one person through this process is a generational benefit. It changes the family and the dynamics for generations. And so we don't see just the immediate investment in the person, but the impact that that has long-term. So next I want to share about United Way of the Piedmont. So focusing specifically on what I was talking about earlier, the challenges around childcare and certain costs that we can draw out from the self-sufficiency standard. Those are the things that often keep people from advancing. So I don't know how many of you have heard the term the fiscal cliff or the cliff effect. In public policy, it really is about, and this is the water you all swim in every day. There's the threshold at which people lose more than they gain because benefits are often cut off at a certain point in very drastic ways. So United Way of the Piedmont has undertaken a pilot program where they are working with 20 single mothers in their community for 1 to 3 years to intensively work with them to get them to the next stage of financial stability. And so these efforts, this is what it looks like in Spartanburg County, and assessing what folks need, and this is informed by the self-sufficiency standard. So definitely looking at how do you move people to a place where they can really make advancements in life, and benefits are not the means by which they get trapped. So doing exciting things there, looking at how that works, and then looking at opportunities moving forward to replicate this in a variety of ways. So these are the ways that they've mapped out to that are best practices for ending the cliff effect. And as you can see, there are a number of ways in which that is accomplished. It's not just through their investment, but their investment is a part of that. The concrete availability of childcare and alleviating that cost for a single mom is an important part of what will allow them to move forward. And so if you're looking at, okay, how do we help, or what are some concrete ways, this outlines what that looks like. So next I want to move on to United Way of Pickens County. They had the Pathways from Poverty program, and also worked in one of their local high schools around financial literacy. And again, the theme of financial literacy. Basic understanding of financial concepts is a cornerstone of financial collapse and vulnerability for a lot of people. And I'm sure everybody's on mute, but I would say, can I get an amen? Because we all know we meet so many adults who don't have, there we go, there's Chynna. We meet so many adults that lack basic skills around savings, around wants versus needs, around tracking spending, around understanding where their money goes. You know, a lot of us struggle with that in a variety of ways, but it is most prevalent in generational poverty. You can't pass on what you don't know. And so those skill sets that make them vulnerable to high interest rate loans, a number of other things, are part of that. So I'm focusing on that with some motives for the end of the presentation, because I'm going to encourage some folks to work specifically on a couple of things. So at United Way of Pickens County, they have also taken a very intensive approach to helping families. And so they are, through the Pathways to Poverty program, they have designed learning modules for families who are at 200% of the federal poverty line. So they work with them to build budgets, increase their income and savings. Sometimes that means working more hours, right? We have so many people in South Carolina. If we looked at our labor profile, most people work in retail and accommodations more than anything else. So hospitality and manufacturing. And so those specific types of employment really need financial management skills, because they are going to be living on different money margins than others. So you'll see that this is the curriculum that they take their families through. They have matching funds for families who work additional hours. There are incentives built into the program, and they work with them over the course of several years. Again, going back to generational poverty, this is a way of breaking that cycle. So one of the families they're working with now has 4 children. The father lost his job and is now working in fast food, and they are working with the mom. She has a degree in she has credentials in the healthcare field, and she's now going to nursing school. So that will create long-term benefits for both the family and the children. And they have a very compelling story we'd love to share with you for those who are interested. And lastly, this is the work that they did within their local high school. When they got there, they did pre and post tests and saw that the majority of students in the class didn't even have a basic fundamental or money management basics. They didn't know about budgeting. You know, nobody has a checkbook anymore, or maybe some people do. But you know, we don't have checkbooks that we balance, right? So how do you track your finance? A lot of the kids came from generational poverty, so didn't necessarily have the money skill set. So walking them through this gave them skills for years to come. And our folks in Pickens County United Way see the kids who went through this program, and they often share about their savings account and how hard they work to do that. And for them, it's a sense of security, especially if they come from low-income families. And it's an empowerment tool that's really important. So those are just a few examples of how we are investing as a network in making change based on the data that we have to moving families to financial stability. Now, last but not least, I would be remiss if I didn't talk about public policy. It is so important. We can invest in individuals and make individual change, but public policy is the way to affect the masses, right? And United Way's approach is we invest, we learn, then we advocate. We advocate based on what we see, and what we see is that there are thousands upon thousands of people who desperately need basic financial literacy capacity that don't. And so we are supporting a bill right now, Senate Bill 16, that would integrate financial literacy coursework into the SC graduation requirements. We have actively pursued this, reached out to our senators. I would recommend that everybody go to scstatehouse.gov, read over the bill. If it aligns with the work that you do, reach out to your senator. That bill is active and moving right now and has a high likelihood for movement. These other two bills are getting less movement, but really important and examples of what public policy in this arena would look like. So the House Bill 3130 is the Opportunity Zone Enhancement Bill. That bill would parity tax credits on the federal level, on the state level, and it would also provide the component we are most interested in is sales tax credits for grocery store chains that locate in food deserts. So we see that the bill may have some challenges because of the large scale of it, but we'd like to see a piece of that broken out because, as Chynna mentioned, food security is a huge issue across our state, right? And lends itself to healthcare issues, all kinds of other things. And so that's one way that policy will make a huge difference. And my last thing, and then I'll stop because I see my time is almost up. So telemedicine is important, right? Chynna talked about how all of our hospitals are, shutting down in these rural areas, and it's been painful to watch in the State House after the last few years. So there are several telemedicine bills out there that matter. And the county housing court bill, it's not getting a lot of movement, but we have the highest rate of eviction in the country. And curiously enough, Cherokee County has the highest rate of eviction in the country. In South Carolina, Cherokee County has the highest rate, and we have the highest rate in the country. So the county housing court requires tenant counsel. So it provides resources for tenants, right? Who, and unfortunately in South Carolina, are often misplaced. So these are just a couple of examples of how you can work on policy that this data informs. And certainly the self-sufficiency standard and all of the things that Chynna's outlined are examples of what that has looked like for decades. So we encourage you all to look at ways that you can do the same work in your community. We invite you to work with us, and we're here to answer any questions. Thank you.
Naomi, thank you so much. Madeline put in the chat how important it is that we have a strong United Way network in the state, and we're certainly grateful to you and your colleagues for the important work that they do. Amanda's asked a question about other United Way organizations offering financial literacy classes, and Naomi, I don't know if you'll have much to add there. I will say that if the United Way is not offering something themselves, Amanda, then they are likely funding or supporting in another way for that information. So anyway, reach out to Naomi. We'll make sure we get you connected. We're going to scoot right on into the Q&A session, not the Q&A, excuse me, the breakout sessions. I'm sorry to say we don't have time to do a lot of Q&A. What I would encourage you to do is if you've got questions, to make note of them. You can put them in the chat box. You can also reach out to any of us on this call, and we'll make sure that the appropriate group has the opportunity to respond. Ben Bullock is going to be breaking us into groups of 5 randomly, and we're going to spend the next 15-20 minutes in small group discussion to talk about, reflect essentially on all of this information, the things that Chynna has shared, the Stark data, but then also examples of action that Naomi has outlined so well. I'm going to put into the chat box now some suggested questions that you might want to cover when you're in that small group. Obviously, if the conversation takes you in a different direction, that's fine too, just as long as hopefully we stay somewhat on topic. What we would like you to do is to identify somebody in the group to sort of, make note of any key points that you have. We're not going to do a formal report out in a traditional sense, but we will invite you to put a couple of key points into the chat box when we reconvene as a group. So I'm getting some head nods. I assume those instructions were relatively clear. So Ben, I'm ready when you are.